One, we need to take them a lot more seriously, particularly in kids. They've got a whole lifetime ahead of them too, and so we certainly want to avoid them having multiple concussions. It's not a matter anymore of accepting that you just shake it off and get on with it. So even if there are mild persistent symptoms of someone just not being right anymore after a couple of weeks, then take them seriously. So stop play, get care straight away, and then if you've got persistent sort of symptoms afterwards, then you need to be seeking further care because there may be things we can do to help.
If you've ever been involved in a car accident, suffered a head injury while playing sport, or tripped and had a fall, then you may have experienced concussion. It's a term that most of us are familiar with, but what does it really mean? Once again, I'm with Paul Graham from Harmony Vision Care on the Gold Coast. In Paul's clinic, they regularly see patients who are struggling with concussion-related vision problems. Today, we're going to dig deeper into the causes, symptoms, and rehabilitation of concussion head injuries. If you've had some kind of head trauma or know someone who has, then keep watching because this video has important insights for you. But first, who am I? My name's Paul Salloway. I'm the owner of Optics Digital Marketing. We're an agency that assists independent eye care practitioners to grow their clinic. So, hi, Paul. Good to see you again.
Likewise, how are you, Paul?
Very well, thanks. Very well. So just to put this conversation into some context, how often do you treat concussion patients, and do you feel that concussion is maybe something that gets ignored and underdiagnosed?
Yeah, look, I think, probably less so than in the past. There's certainly a lot more awareness about it. We hear it in the news, and obviously, I've got my AFL poster on the wall behind us. I mean, we've even had AFL careers and rugby league careers cut short because of the awareness of multiple concussions on future sort of brain health. We regularly see people, at least on a monthly basis, and sometimes some weeks where we've got a few cases a week that are coming in to help manage the longer term vision impacts on concussion. But I still do think there's probably still not quite enough awareness, and certainly down in what concerns me is I just am not sure if there's enough awareness in kids' sports and things like that at this stage. I still think that's still some work to do.
Mm. Yeah, as we head into the footy finals season, it's probably good timing to have this discussion about concussion.
Yeah, absolutely.
All right. Well, so what exactly is concussion, and why doesn't it show up in a brain scan sometimes?
Yeah, well, it's actually a mild form of brain injury, but think of it more like a bruise rather than a whole area of the brain that might be taken out, that might occur in a disease or a more serious head injury or having a stroke. It's where the axons in the nerve fibers get stretched and the metabolism changes. So it's this sort of, they call it axonal shearing, but it's not this sort of localized point of damage that will sort of show up in an MRI or a CT scan. And that's where I think part of the issue of the recognition comes from, is that if you rely on medical imaging to sort of pinpoint a diagnosis, concussion just never show up. You're reliant on history and symptoms.
Mm. So the brain is like a very sort of I'm going to say almost fluid, bodily organ. So it's something that wasn't meant to be smacked around and suffer impacts, was it?
Yeah, and it's actually the brain hitting the inside of the skull that causes the concussion. That is the concussion, the mild brain injury.
So what are some of the most common causes of mild brain injury then?
Probably the most common one is falls. I guess we're sort of quite familiar with, sporting injuries, as we were sort of discussing earlier. Something falling out of a cupboard, hitting on your head, walking into a door frame,
Yep.
walking into a door. But the biggest one is probably falls.
Mhm. What about car accidents? I mean, even most people wear seatbelts these days, fortunately. But
Yeah.
even having that, could you still experience some type of concussion?
Yeah, look, and it's probably coupled with a whiplash injury. You still got that kind
Mm.
of movement backwards and forwards, and as much as airbags might save lives, doesn't mean you're not going to get a concussion or other injuries out of it. You're just
Mm.
less likely to have a fatality.
All right. So what are some of the symptoms then that someone could experience from concussion, both in the short term and the long term?
So short term, you get some lightheadedness or dizziness. There may be some disorientation. These sort of persistent low-grade headaches. People complain of poor concentration, difficulty finding words, brain fog, getting sort of feeling very tired, irritable, anxious, maybe even depressed. They may not be sort of sleeping well, and there might be a sort of an intolerance to sort of our two sort of big stimuli being light and sound.
Mm.
Are probably in the short term, specific to vision. We've got things like blur, even double vision. Um, uh, Probably the stuff that we're dealing with is when you get more into that long term, that when you get past that sort of recovery phase
Mm.
of when you're expected to recover from a concussion.
And is the recovery process different for kids compared to adults?
Yeah, so if you have symptoms past 2 weeks or as an adult, or past 4 weeks as a child, that's considered post-concussion syndrome. And so you start looking at things like balance issues. You can get into things like people start having problems with being in open spaces. They might find busy environments quite disorientating. For adults, obviously driving, that the sort of all the movement in their peripheral vision plus the stimulus and the motion in the car can be quite overwhelming for some of them. They may have difficulties with reading or device use, issues with judging depth, and again, light sensitivity seems to be one that we see in post-concussion syndrome, that sort of persistent sensitivity to light.
Headaches? Is that a
Yeah,
serious?
headaches are part of it as well. So persistent sort of low-grade headaches.
You mentioned brain fog. What about sleep? Does concussion interfere with people's sleep patterns?
Yes, seems to. Yeah,
Yeah.
yeah. They don't sleep well. Or don't get good quality sleep.
All right. Well, let's talk a little bit more specifically about vision and how concussion affects vision, because I've read that up to 80% of concussions involve vision problems. So why is the visual system so heavily affected by head trauma and concussion?
Well, the visual process and our sort of using our vision to sort of understand the world around us, we like to talk about it as being the master sense. And there's a good deal of the brain architecture that is used in the visual process. There's lots of information flowing backwards and forwards to a big part of the brain. If we like to say, if you could lift the top off a head and look inside, a lot of that grey and white matter is dedicated to visual processing. So it's easy to impact on a part of the visual process during a concussion. And you've got a lot of the motor centers for the visual
Mm.
system in the brainstem, and that's obviously also something that can be affected in an injury, particularly one where there's a sort of almost like a
Mm.
whiplash kind of situation as
Mm.
well.
Mm. So does it affect your peripheral vision?
So you don't get peripheral vision loss as such. So a more serious brain injury might actually damage a pathway, where to the point where you actually lose the ability to actually
Mm.
see your peripheral vision. It's more comes down to more motion sensitivity and sensitivity to movement in your peripheral vision, and that's where people get overwhelmed by. They go into it. They hate shopping centres. There's too
Mm.
much movement going on. We often see it to the sensitivity to light, sensitivity to patterns, and so walking into the grocery store aisle can
Mm.
be
Mm.
quite that strong sort of structure of the shelves. If they've
Mm.
still got fluoro lights, that flicker tends to be bothersome, and then you add noise on top of that as well. You've got lots of hard surfaces and lots of people and music and whatever else going on, so that can be quite overwhelming. But a big part of it is not being able to judge where you are in space, in addition
Right.
to not being able to process all that movement. It becomes quite overwhelming.
So binocular vision dysfunction is a common thing.
Yeah. So look, you see lots of different estimates, but if we said roughly half of people with post-concussion vision syndrome probably have a likely to have a binocular vision dysfunction as well, in some part.
And are they like short-term or long-term symptoms?
Look, they again post-concussion. It can mean past the 2 weeks, you're getting into sort of short to medium term, but certainly we certainly see people come through where they've been dealing with symptoms for months, if not years. So it's something that may not recover by itself.
All right. Well, so if you're getting value from this interview so far, so please hit the like button. It's a simple thing, but it helps us out a lot with the YouTube algorithm so that other people can get value from this as well. All right, Paul. So let's talk about your clinic then. So if somebody has vision problems after a concussion, what treatments are available through optometry?
So obviously we want to do a sort of thorough assessment and just make sure that there is nothing bigger than a concussion, that it's not more getting into sort of that brain injury, but hopefully that's all been sort of checked out medically at the time of the concussion. That's quite often the case, that people we're seeing have been through a fairly sort of thorough medical checkup. But we're looking at what are some of the things that we can do to improve the quality of life of the person suffering with post-concussion syndrome. Are there things we can do to help manage their sensitivity to motion in the periphery? Are there things we can do to make their vision as clear as possible? Are there things we can do to reduce the photosensitivity or the light sensitivity? And so we tend to break it into, sort of what can we do with lenses? I mean, that's obviously a tool that is available to optometrists to be able to prescribe to patients. And so there may be prescriptions that help with focusing at near. We explore whether even small uncorrected refractive errors, whether that extra clarity actually helps someone. Sometimes people who have post-concussion vision syndrome can be quite sensitive to prescriptions, and so we might be doing the opposite. We might find that what they used to be wearing feels too strong now, and so it's about finding that kind of point where they're a little bit more comfortable. So there's a fair bit of time sort of exploring, not just what is the clearest lens for you, but what's also comfortable. We can obviously use things like tints to just reduce the volume of light or the intensity of light. Sometimes that might be specific colors if we find that people are sensitive to a particular part of the visual spectrum. So it can be anything from a grey tint through to a coloured tint. It can be sort of quite individual. And right through to, are they getting double vision? Do we need to have a look at any sort of prism? There are things within we call it neuro-optometry. So if we look at the neuro-optometry space, there are other things we can explore, like sectorial occlusion. It's probably a bit too big a topic to get into with this, but there are other things we can do with lenses just to try and reduce the overwhelm and the amount of information that the person's having to deal with.
Could contact lenses also play a role, or are you really sort of restricted to spectacles?
That's a tough one to answer because that's kind of a very individual situation. There is some dry eye, irritated eye kind of symptoms that can sometimes come in, and it may be something that's a bit too early. But if we have someone who is that we figure out that the magnification or the minification that you get from your prescription upsets your sense of where you are in space, that might be something where we explore using a contact lens, because we don't get as much of those magnification or minification effects. So it's something that we'd have in our back pocket as a possibility based on how the person presents. But like I said, we'd have to kind of balance that out with dry eye state and things like that.
Okay. And you said that with the tints, that there's no one size fits all. Different people have different reactions to different tint colors. Is that right?
Yeah, and I think what will happen is within this space you'll get certain trends where there seems to be either blue or amber, as an example, seems to be a popular one, and or it could just be a simple reduction in it. So, like I said, it might be just a little bit of grey is enough just to take the intensity out. But we do find some people seem to prefer a particular colour, and some of the research sort of says that yes, some people do have a preference, but even just like I said, a basic grey tint can be sort of helpful, and that's part of the individual approach. Is that we've got all these sort of tools available to kind of work out: do we need to be going down the path of something very, very individualized, or can it be something more simple for you?
And with post-concussion syndrome, do you sort of give advice to people about how they can adjust their environment, whether that be at work or at home, to sort of accommodate those issues?
Look, a lot of the time they have made those adjustments themselves. And so sometimes what we're doing is looking at ways of, okay, are we able to get you to sort of handle life without having to live in a dark room, or, avoid those certain spaces? Can we sort of make those areas that you're avoiding easier to deal with by a simpler device?
Yeah. And so people like, if people, maybe elderly people, are having problems with balance and judging distances, then there are probably things that they can do at home to make that a lot safer for them.
Yeah, and look, I guess if we're getting into that sort of sphere, then that's where we might refer to physical therapists and occupational therapists who are very well grounded at looking at how people are living safely in their own homes, and so we'd probably lean into those sort of services because they're very, very well equipped.
Mm-hmm. Okay, well, so last thing I want to ask you is, what steps can people take to reduce the risk of concussion, both in sport and everyday life? I know you've got some thoughts about helmets and how much of a role they really do play. So do you want to just explain that for us?
Yeah, look, it's interesting when you look into the research. It's kind of mixed as to how much helmets are useful for reducing the risk of more major head injuries, but there's still question marks over the usefulness in actually avoiding concussions, because the brain can still move in the skull. There are some thoughts that people go in a little bit harder. They're probably less careful, less cautious by wearing a helmet, because there's this conscious or unconscious idea that the helmet's going to look after that, so I can play just as hard as I always played, as opposed to looking at it as a bit of a tool. I've even seen some discussions around just you're not getting the pain signal of something actually hitting your head, and therefore you don't necessarily protect yourself or react in that moment as quickly. So it's not to say that helmets aren't useful. We've just got to be careful that we don't overstate the usefulness compared to other strategies like making the sport safer. Making sure that players if there's any suspicion of a concussion, the player has to come off and is not allowed to go back to play until it's confirmed medically that they're clear to play. So that because people who have a concussion are at risk of having yet another one, particularly in those moments where they haven't yet recovered from it properly. And so sports are an easy one to kind of talk about when it comes to sort of prevention and things like making sure that you're playing the game fairly, and obeying the rules and being a good sports person make a big part of that. With falls being probably one of the major concussion risk factors, then in reducing your falls risk, and optometry's role, we've got to look at: is your vision good enough? Do you need a correction? Do you have cataracts that might be getting in the way of your ability to judge where you are in space? Are the lenses you're wearing appropriate for your mobility situation? So creating a safe environment is one of them. Making sure that you're getting the right kind of exercise so that you've got good balance, and you've got the right kind of strength, that you're less likely to fall, and the fall, if you do fall, is going to be less serious as well. And that's where we might work with physiotherapists in that degree. One of the things we haven't talked about is that there are another treatment that we do as part of concussion work is actually rehabilitation, and that's
Right.
restoring visual function. So that's where vision therapy comes into it. When we apply vision therapy to brain injury and concussion cases, we call it neuro-optometric rehabilitation, because you're restoring binocular vision function, you're restoring ocular motor function, you're looking at whether you can sort of impact on visual processing. And so that's the second tail of our treatment. So we have the first tail, which is making people more comfortable. The second part is, let's see if we can make improvements on the function that you've lost. And that's where we sometimes work in with physiotherapists, either from a vestibular point of view, so people who are getting dizziness and we suspect there's a vestibular component to their symptoms, or there's still some physical ailments that they need to work on.
Mm. Just educate me here. What's the vestibular?
Oh, vestibular is part of your balance mechanism. So it's your brain's way of detecting changes in movement. So we have these semicircular canals that are orientated to check different types of movements. We've also got a saccule and I've forgotten the other one, utricular, and that detects forward and back and up and down motion as well. And when you're making sense of movement in the environment, we have this visual input, but we need to understand if the movement that we're seeing is self-directed movement. So we need to get feedback from the body, proprioception in the neck and the rest of the body, and also those accelerometers to kind of go, oh, that movement was from X, Y, and Z.
Okay. It's a very complex mechanism.
Absolutely.
That helps the brain to make sense of the world that we move through.
Yeah, which is why we say, vision's more than what you can read on the bottom line of the chart. There's so much going on. It's such a complex thing.
So if somebody, has a knock on the head while they're playing sport, or they fall over, and they might say they feel fine, what do you recommend that they should do just as a precaution?
Get checked out medically. Go to the ED, go to the hospital, go to the GP. Well, they're harder to get into, but if you're talking a head injury, then I don't think you can take them too seriously. So heading to get medically checked.
And so that would, if they're still experiencing problems, that would maybe lead to a referral from them to an optometrist like you?
Depends on, hospitals themselves have rehab facilities now. That doesn't usually involve optometry. They may get sort of checked off as far as is everything healthy? Are they sort of seeing well? Are their visual fields okay? Maybe there might be some gross checking of whether they've got binocular problems. Our referrals tend to come later on, when they're past that sort of recovery phase of those 2 to 4 weeks, when they've got these persistent symptoms that just haven't recovered. So we typically get our referrals more from people finding us or from physiotherapists, where they're sort of saying, hey, this is more than just vestibular or musculoskeletal. There's something visual going on here.
Right. So you see people who are having, more persistent issues then.
Absolutely. Yeah.
Okay. Well, so, this has been a fascinating talk as usual, about a very important topic. Before we finished, any last thoughts, Paul, on concussion and what people should know about it?
Yeah, look, one, we need to take them a lot more seriously, particularly in kids. They've got a whole lifetime ahead of them and so we certainly want to avoid them having multiple concussions. It's not a matter anymore of accepting that you just shake it off and get on with it. So even if there are mild persistent symptoms of someone just not being right anymore after a couple of weeks, then take them seriously. So stop play, get care straight away. And then if you've got the persistent sort of symptoms afterwards, then you need to be seeking further care, because there may be things we can do to help.
Okay. So how can listeners get in touch with you at Harmony Vision Care?
Okay, so we've got harmonyvisioncare.com.au. So we've got a wealth of information on the website. You've got the ability to book online with us. If it's something that you feel that you need to discuss with the staff, then you can call us on 0755205900 to sort of find out more, and the staff are well versed on being able to answer your questions. and help you sort of book in if that's the next step.
All right. And once again, don't forget to hit the like button and subscribe to the YouTube channel if you'd like to be notified when Paul releases more highly valuable YouTube videos like this one. And also, please follow Paul's Facebook business page and Instagram account for Harmony Vision Care to see him post updates on the latest news, promotions, and events at his Varsity Lakes practice. All right. Well, thanks a lot, Paul.
Thanks, Paul. Thanks for the opportunity of talking about something that's really important.
Indeed. So for everyone who's watching, be careful out there and have a great day. Bye for now.
Thanks, mate.